So, happy to be here. My name is Ulli, and today I'm going to talk to you about how healthcare will change in the very near future, how it will change more than the past 50 years. And the title is From Patient to Human. Let's start with the patient. Who of you has never been sick, never been in a hospital, and never been diagnosed anything? I don't know if you're not paying attention or if you just have been sick. I think you all have been a patient one day. The word patient originates from, and there are different definitions, but it originates from the one who suffers. And I think you have an idea why. Be patient. Good things come to those who wait. It really depends on the legislation and on the system and on the nation that you're in. But if you're lucky, waiting times to see a specialist are below 4 weeks. I think we have all experienced this pain at least once in our life. You familiar with this one? To sum it up in short, it sucks to be a patient. Nobody wants to be sick. I think we all agree. And it sucks for everybody else too, for everybody who's not sick. Let's have a look at these figures. I think you're pretty familiar with those. So that's percentage of healthcare spending, percentage of GDP by nation. And we have a winner here, and that's the US, with around about 18% almost. That's almost $3,000 billion annual spending for healthcare. And if you're familiar with it or not, average number of visits, doctor visits per year in the US is way below average. And healthcare quality in other countries is said to be better. But what are we all paying for? What are these costs coming from? I think it's really an amazing figure to look at. That 75% of all healthcare spendings are actually for chronic diseases, and of which 80% are preventable through a healthy behavior and a healthy lifestyle. To calculate it with the number of example of the US, that means that 60% of the costs, as much as $1,782 billion per year, would be preventable by a healthier lifestyle. That's as much as the GDP of Scandinavia combined. And this is why healthcare starts way too late. It doesn't start at the cost. It starts with the patient, not with the human. And it starts when you have a diagnosis and when you're diagnosed with a certain disease. And that's also a reason why there's so much room for improvement and so much costs to be saved. And what I'm talking to you about today is how we can tap into a change in paradigms. How we can see healthcare changing from treating patients to enabling humans to do a healthy lifestyle, live a healthy life, and essentially benefit everybody by decreasing healthcare costs. And I think the biggest driver is digital health. And we call digital health the revolutionary fusion of both medical knowledge, which is not new, and IT solutions which are now available to everybody. Is there anybody in this room who does not have a smartphone? Raise your hands. Sometimes there's one or two. Today I see none. So the availability of IT in our pocket, in everybody's pocket, combined with today's solutions and applications, is really what will drive the biggest healthcare shift in the past 5 to 10 decades. And we see some amazing market studies showing that mobile health will grow as quickly as 11-fold in the next 3 years to a volume of $26 billion. It's the time to invest now. And I call this bullshit. $26 billion US dollars worldwide, it must be a joke, and I tell you why. Projected cost savings in the EU alone is 77 billion alone from digital health solutions in the next 3 years. So what those consultants who did the study only looked at is how much money you can make with selling apps, with selling services and stuff, but they are not looking at the big picture, and that's really shifting the responsibility of health and healthcare costs from the provider side and the provider-driven business, not to a patient-centric approach, but to a consumer-centric approach. Healthcare is the new plastic. We believe that it's right before a third wave of IT adoption, and that's the consumerization of healthcare. There's another figure, $100 billion to be saved by managing diabetes in a proper way. And managing diabetes in the proper way is not having better treatment, better IT systems for our healthcare providers. It's about avoiding people to be in the danger zone, to fight pre-diabetes with smart digital health solutions. And it starts with the consumers. Big players agree. Google is investing in the Google Fit platform. You all saw Apple Health Kit. There's a lot of movement going on. We founded XLHEALTH past year, and we see so many startups coming on, so many conferences. The share of healthcare startups or digital health startups at Slush conference, I think, is also bigger than last year. And this is what is not new. You know this guy, the inventor of the light bulb? Said the doctor of the future will give no medicine. You can read it by yourself. But the cause and prevention of disease is what matters. And digital health will enable the individual and the consumer to act on this and to proactively take one's health in their own hands, like this. And this is why we invest in digital health. And this is what we do in brief. We invest venture capital in digital health, startups all over the world, main focus in Europe. And we support entrepreneurs with experts, mentors, capital, and infrastructure. And what we try to do and what makes us unique is we try to bridge the gap between the old system, which is a doctor-centric, or if you want to, it's a patient-centric approach with health IT, with electronic health records, with practice management systems. We try to bridge this gap to the consumerization of healthcare through digital health, smart applications, and mobile health applications. And I'll show you one example very briefly how we do it. One of our investments is a company called My Sugar, and they provide a smart diabetes diary for type 1 and type 2 diabetics. It's a brilliant application. They have like the largest consumer base in mobile health applications for diabetics, and they have a very good application. What we try to do is bridge the gap between the old world, the old doctor, and the new world, the new doctor in your pocket, by providing connectivity and interoperability. And we do this together with our strategic partners. And one of them to highlight is CGM, which you might or might not know of. It happens to be a European market leader in electronic health records and practice management systems, hospital information systems throughout Europe. So that's what we're doing. That's, in a nutshell, why we believe digital health is the next big thing, is the next mega trend, and that's why we invest venture capital in this field and nowhere else, and solely in this field. If you're interested about more of this, I'm happy to talk to you after this talk. Thank you very much.